So, yeah, the key terminologies for today's presentation, it's working in health and social care. So we'll just jump on to discuss the indicative content with you and then the key terminologies. Um, so prescriptions, so it's some medications, they are there for minor illnesses. They can be brought over the counter. You don't need a prescription for that. And so that you can treat yourself without the need to see a GP. So that's a facility for you. But there's some painkillers and some drugs that you need as cough remedies, for instance. You can buy them directly from supermarkets and other stores. They're available there because these things happen on a regular basis. And if you're in pain, you should not be, or the patient should not be waiting for medication from the coming across the GP. There's some other types of medication also, like you have eye drops, emergency contraception. These are available without a prescription, but you would need a pharmacist supervision to use this medication. And so they're only available to buy from behind the pharmacy counter. The pharmacist may ask you some questions to make sure that the medicine is actually suitable for use for you. Prescription, there's some medications that are like antibiotics that must have a qualified health professional to prescribe it for you. They can be a GP, a hospital doctor, a dentist, a nurse, pharmacist, optometrist, or a physiotherapist or a podiatrist. So these are all the cases where you would need a prescription. So there's some important aspects when you consider medicine administration. There's 7 R's that you could remember. This is easy for you, so it's a way of remembering whenever you're administering medication. So the first is the medicine for the right person? And the second is, are these the right medicines for the individual as per their medical records or their sheets that are there? Is this the right dose as per the individual's MAR? Are these medicines being given at the right time, in the right form, and is the right route being used? And what is the medicine bringing improvement by providing the right outcome? So that's there. Right person, right. No audio. You can't hear my audio. Can you not hear me? Can no one hear me?
Yes, I can hear you.
Okay, I don't know, there might be some problem with your setting, Richard. Yeah, thank you. Okay, so the right person, right medicine, right dose, right time, right form, right route, and right outcome. So these are the 7 R's that you could remember while administering medication. So what is administering medication? It's just you choosing the person or the patient who's there for any sort of medication that they require at the right time. So that's the route that you're using for administering that medication. So the medicine can have different forms, and methods of administration would also depend on the illness and the patient's needs. So there's 6 most common routes. There's the oral route, where you have liquid, solid, different routes like liquids and solids. You have the rectal route, where you can't swallow, the patient can't swallow the medication. You could use rectally a suppository. For instance, inhalation is the third route. So medication is inhaled through the patient's airway. This can be in the form of a powder. So sometimes you can use inhalers for your asthma, for instance. These can use you can use a mask or a tube also for this. Nebulizers are there. So a nebulizer is a machine which allows the patient to inhale the drug, and this is a very fine mist. So it's very similar to an inhalation. Transdermal is through the skin. So the drug goes through the skin into the body, and that doesn't break the surface of the skin. So this is sometimes mixed with a chemical, the medicine, and it penetrates the bloodstream, but it's there for a longer period of time. So you have, if you want a drug that is that sometimes the drugs, they have longer duration of action for a longer period of time. They are there to act, for instance, um, some ways of um, uh, sexual protection, like for instance, if you want to use some pregnancy protection drugs, you could always use transdermal patches that are there, and they have a constantly controlled level of being there in your bloodstream, being released over a longer period of time in your bloodstream. And then the last one is the injections. They can be transthecal, that can be in your spine, subcutaneous under your skin, intravenous into a vein, and intramuscular into the muscle. So there are different types of medications and their effects and their potential side effects. So there was the Medicines Act in 1968 that classifies medicines into three legal categories. You have the general sales medicines, GSL. These can be sold in the supermarket. They don't require a pharmacist, as I mentioned earlier. You have the pharmacy medicines, which can be sold only in pharmacies under supervision of a pharmacist. So you have ibuprofen or aspirin as an example, and prescription only medicines. These can be obtained with a prescription from a pharmacist or a doctor. For instance, any antibiotic. Um, yeah. So any questions in between, please let me know. I'm happy to take them. So these above legal categories we've mentioned, medicines, they are then further categorized into other ways, depending upon their purpose for which they are used. So you have antibiotics, which are used for treating bacterial infections. The examples can be penicillin, amoxicillin, flucloxacillin. People who were allergic to penicillin, they could have other medications. So a whole list of medications that are antibiotics, and these are basically for treating bacterial infections only. So they're not for any other purpose. They're not there for viral infections. You have analgesics that are used for relieving pain. Then you have antidepressants, treating depression and other symptoms of depression, or like anxiety also sometimes. You have controlled drugs that may be prescribed by a doctor or another qualified person. You have other drugs that are there for treating other conditions such as antihistamines, antacids, and non-prescribed medications can be used to treat minor symptoms like homely remedies like honey and milk for a cough. So there are common types of medication and their effects and potential side effects. So antibiotics, for instance, you have amoxicillin. The effects are obviously to treat bacterial infections like pneumonia. You have ear infections, you have UTIs, urinary tract infections, other infections going on. Side effects could be having diarrhea, you could have a stomach pain, nausea, vomiting, headache, swollen glands, swollen tongue. So these are there always on the leaflets, and patients can, if they're aware of these side effects, they can then have a record of them. You have painkillers or analgesics like aspirin. They're used to treat pain, fever, and and inflammatory conditions. So anywhere you have pain or there's a fever or inflammatory condition, that could be a swelling also, it reduces that and relieves these symptoms that are felt in the body. So these can lead to aspirin, if it's taken, could lead to heartburn. It could lead to an upset stomach, drowsiness sometimes, and headache sometimes. So not all of these patients who are taking these medications would experience these symptoms. There's just some patients who might have these symptoms while taking these medications. So you have antidepressants such as amitriptyline. This is used to treat symptoms of depression. So it affects the chemicals in the brain that cause the depression because they may be imbalanced. So these amitriptyline in particular may lead to constipation, diarrhea, nausea, vomiting, mouth pain, a rash that you may develop, changes in appetite, and changes in weight. And please be aware that there may be medications that have drug interactions also, so that one drug is interacting with the other drug. So there may be that case also, due to which you may have um, a potential side effect. And then there are controlled drugs. This Ritalin is used to treat conditions like attention deficit hyperactivity disorder, ADHD, narcolepsy, which is again a sleep disorder. This drug acts by affecting the chemicals in the brain and the nerves that contribute to hyperactivity and impulse control. So their side effects would be changes in mood, irritability, feeling nervous, insomnia, which is inability to sleep, fast heart rate, weight loss, loss of appetite, nausea, vomiting, stomach pain at times. Other drugs like antacids can be taken, such as Gaviscon. You can take it over the counter or from a local pharmacy. Sometimes you don't need a prescription. So this is to treat heartburn and a stomach which is upset. This can also lead to constipation or diarrhea. Non-prescribed medications such as olive clove oil or any other some other oils also that can be used to relieve toothache. Some people have increased sensitivity of the teeth after using it, or they may have irritation on of the inside of the mouth by using it. Different routes. So there are different routes based on what the patient prefers. So medications can be administered to the individuals using different routes and forms. So the route and form that is used with the individual, it will depend upon their own preference. So different patients have different preferences. As I said, sometimes the patient might not want a tablet and may want a capsule form or may want a drug in the form of a liquid. So you'll have to then change your medication according to that patient's needs. There are other needs, so sometimes they may find it hard to swallow. Some children, obviously, for children, it is not applicable. Then in some adults also may find it hard to swallow medication. So in that case, you would then prefer a liquid form. The individual's condition. So sometimes the patient may not be in the condition to actually take the medication orally, let's say. Then probably the patient is is in a fainted condition, or is the patient is drowsy, can't swallow the medication in whichever form you're giving it in. So that in that case, you could give it intravenously. Sometimes you could give it, sorry, topically through the skin or even through inhalation. Sometimes some drugs can be given. So oral medication, if we start by this route is the most common. It's used for medications. So you use oral medications in the form of tablets. You have drugs, you have syrups, you have liquids, you have capsules, suspensions. So you have tablets and capsules, such as some different antibiotics come as tablets, sorry, and capsules. So they can't be broken, otherwise they're not effective. So that is why they have to have a tablet or a capsule form. And so sometimes they have a line in between, so they can be split into half easily if the dose is given in that form. So there are other tablets that have protective coating. So some anti-epileptic drugs, they can have and must not be removed from their packaging until they are taken. Otherwise, they may not be effective. Some capsules and suspensions must be taken before food, others with food, and some after food. And this is the reason why you need to know the requirements of these medications so that you can easily administer these medications correctly for the right person, at the right time, through the right route, for the right reason, and having the right outcome. So otherwise, obviously, they'll not benefit from these medications, and which then may lead to their pain, discomfort, or condition being worse. Some medications are taken under the tongue, sublingually. So these are not swallowed. So this route, sometimes they are sprayed for pain relief, or they're placed under the tongue for anxiety relief. Sometimes you might have an angina patient taking a nitroglycerin, for instance, through the spray, GTN sprays, they're called. Or you could also take painkillers for these patients to have effects that are very quick, because your tongue, it's connected with your central circulation, and that's where the drug is taken, and it reaches its site quickly, instead of going through orally and then having to go through the gut and then through the whole system. Then you have drugs that you're taking So, as I said, inhalation drugs are there to obviously be there for your for an impact. Like, for instance, there's an asthmatic patient. This would have your inhalers and nebulizers. Uh, Sometimes the patient needs uh, lung support. Sometimes that support needs to be in the form of proper drugs. Sometimes you might not need just saline water, depending upon whatever is required. So this helps individuals with respiratory difficulties to get their medicines as quickly as they breathe directly into the lungs. So they're absorbed directly into the lungs. And there are different types of inhalers and nebulizers depending upon what medication is required. So an individual with asthma would want a Ventolin, for instance, which is blue colored once they're having an asthma attack. Sometimes they may use a preventer inhaler. This may be on a daily basis to prevent asthma symptoms, uh, to reduce the chances of having an attack, which is very deadly also sometimes. An individual with respiratory difficulties and struggling to breathe, they may use nebulizers also. They change liquid medication into fine mist. So the fine mist is then breathed in the lungs, in the person's uh, into the lungs, and it reaches directly into the lungs through a mouthpiece or a mask. So there's a person who has bronchiectasis, which is an inflammation of the bronchial airways. They may use an atomizer, jet nebulizer, or an ultrasonic nebulizer. So what this does, it uses an aerosol compressor to vaporize the medicine, and it turns it into very fine mist. And then you have and then the ultrasonic nebulizer uses high frequency sound waves to turn it into a fine mist. So these deliver medication more quickly, and it's quieter when it is operated, but are used with a mouthpiece and a mask, and they have their mains, and they're used through a battery. So intramuscular, so through the muscle, you can use these medications through injections, obviously. It's directly given in different parts of the body, such as arms, legs, or buttocks. And the medication can be absorbed directly, quickly into the bloodstream. Intramuscular injections can only be carried out by a doctor or a trained person, such as you can also give a vaccination or a flu jab to a person, and that would also have the intramuscular route. Intravenous is through the veins. So it's medications that are directly transferred into the veins by an injection or an infusion, sent directly into the veins using a needle or a tube. Sometimes you may use it as a drip. And this would also be carried out under supervision of a doctor or a nurse. This is used in emergency situations when medication that you've given has to be delivered faster. So a person who is going through an MI, a myocardial infarction, a heart attack, or an individual who has extreme pain, they could be given morphine intravenously, which directly reaches the bloodstream without having to go through the oral route and then being transferred into the circulation. So subcutaneous instillation, you have drugs that are given under the skin. So this involves medication like insulin for diabetes, heparin for treatment and prevention of blood clots. So people who require these types of medication, they'll have a specialist training if they self-administer these. So if there's a person who's a diabetic and wants to administer these drugs, they'll have to have training on it um, before they are able to do it, obviously. Otherwise, they'll have specialists to do that for them. Installations. So this route involves administering drugs into the eyes, ears, or nose. So that's through liquid or suspensions. These are again not done without specialist training. An individual with an eye infection may require eye drops, and an individual with hay fever may need nose sprays. They can do it on their own, but they need to be aware of how much to be instilling inside their system. Rectal and vaginal, as I mentioned earlier. So rectal and vaginal are used when you have enemas, for instance, or suppositories or pessaries that you want to use um, through these routes. So they are not taken by without a trained person because they're sensitive parts, and they're obviously used for different purposes. Different drugs are administered through them, and it is mostly when you can't administer these drugs orally or through any other route. Topical, this is applying skin medication on the skin. For instance, you have gels for treating your pain. Let's say you have eczema or athlete's foot, so you want to provide quick relief for symptoms. So you could have oral medication as well as topical medication, but sometimes only topical can also do. So that could serve the purpose. Transdermal, these are patches mostly, so they are directly applied to the skin, and they can be absorbed into the body, the medication, through the bloodstream, and very slow and over time. So you have some fentanyl patches for pain relief. Nicotine patches can be used for smoking cessation, hormone replacement therapy patches, or as I said, some contraceptives can also be used and have long acting functions. Unlike other medications, it is important that when you're giving these medications in the form of patches, you ensure that the area of the skin where the patch is being applied is clean and dry and doesn't have um, any sources of irritation there. And there's no person who's sensitive to the patches. In that case, it could have a reaction on that person and would not be suitable. So this is a good summary of the routes of administration and the equipment that's required for different drugs to be administered. You can read this, and it's a good summary of what I've already talked about with you. So then we come to describing how to administer medication safely, and that is which is in line with the current legislations and laws um, provided by the NHS at most of the times. So there are these legislations, guidelines, and policies, protocols that are in place, and you need to be aware of them so that you're providing safe and competent um, care to the individuals. So if you're a lead adult care worker or a lead personal assistant, you may be involved with supporting individuals with prescribed and sometimes non-prescribed medication. So sometimes, like your job involves you to prepare individuals medication for them. So it's administering different types of medication, monitoring individuals' conditions after their medication has been given, completing the medication administration records, and disposing of out of date or partially used medication. So when you know about legislations and you know about organizational requirements, this will help you to understand your work, role, and promote high standards of safety whenever you're administering these drugs. Legislations are there, so we'll talk about some of them. So administration of medication, it is strictly controlled by law. It has many pieces of legislation that are relevant to administering medications. So this table gives you an important key to legislations and the important key points. We'll just skim through them. So you have the Medicines Act 1968. This act classifies medication into legal categories. The local pharmacist or the dispensing doctor, he is or she is responsible for supplying these medications, and a prescription is required from a GP or dentist. The Misuse of Drugs Act, it regulates the 1971. It regulates the use of controlled drugs in order to prevent their misuse, and it creates additional requirements that these are there for prescribing, storing, administering, and disposing of controlled drugs. They must be stored in a secure controlled drug cupboard, and they should be witnessed by a trained member of staff whenever it is being administered. At the Health and Safety at Work Act 1974, this requires both the employers and the employee in order to work together for promoting a uh, safe safety is in, so health and safety is in everyone's responsibility, including when reducing the risks posed by hazardous substances like medicines. It established the key duties and responsibilities of all the employers and employees in work setting in order to practice safety, including when administering medication. So then there's some more legislation, such as the control of substances hazardous to health regulations, the Mental Capacity Act, 2005. You have the hazardous waste regulations in 2005. You have the controlled drugs uh, regulations that was there in 2013. Health and Social Care Act, 2008, the misuse of drugs regulation in 2017, and then you have the Data Protection Act and the General Data Protection Regulation in 2018. What I want you to do, I've given you an assignment previously also, I'm aware of that. So our next session will be basically discussing the assignment, which we've done briefly in the first session, but we'll do it again on a more extensive way in the form of a session. So I'd appreciate it if you could all go through these legislations and just have a look at them, and then we can discuss them in our next session, if that is okay. So one of our LOs says to explain the records to be completed for the storage, administration, and disposal of medication. So when you're a lead adult care worker, you will be required to either administer medication to individuals or then support them to do this safely and competently. So whenever you have medications that are being prescribed by a doctor, nurse, or a pharmacist, this will be accompanied by a prescription. And that is your responsibility to check that the individual who's been given the medication has a prescription before administering the medication to the individual. So you would, in the prescription, you would have the details of the medication. So you would have to check the medication name, the dose that is required, the quantity included, how to administer it, and for how long. So sometimes it's 7 days, any specific instructions, when and how to administer it. Sometimes it's before food, sometimes after food, sometimes during food. Any adverse side effects to look out for, that has to be mentioned over there. Details of the individual should be there, their name, their age, their date of birth, their address, to know that it's the right person that you're administering the drug to. Details of the prescriber should be there. For instance, if it's a GP, it's a pharmacist or a nurse, and the date when it was prescribed. So what is medication administration record, MAR? So it's a sheet that contains detailed information. This is for every medication that the individual has been prescribed. So this is the strength of medication that should be mentioned, the frequency that it must be taken, and the route through which it is administered. So this is a whole chart that is developed for the particular medication that has to be applied to that person. The start and the end dates of the medication would be there. So when you're administering these medication, the specific amount of time, so how many days are you administering it for? Medications that have been discontinued because the individual developed side effects or refused the medication, those are mentioned in this medication administration record. So this MAR sheet will also provide any information on allergies or any other side effects that were there because of some medications. So if you have an individual who refuses to take their medication, that also will be recorded on their MAR sheet. So you will have prior knowledge of the individual's refusal, and you may decide to seek advice from a senior colleague before administering this medication. So one important aspect is to analyze standard precautions for injection control. Okay. So, I'll request you all to please put yourself.
You don't know that you have. You don't know that it's an eyes of people when people see.
Okay, that's done. Okay, so here we'll analyze standard precautions for infection control for administering medication. So this is supporting individuals when administering their medication. It also involves doing so under some conditions that are safe and hygienic. So you cannot go and administer medication anywhere. So it has to be a safe and clean place. Applying standard precautions. This is for infection control. So it reduces the risk of infections that are spread through administering medication. And the main precautions that are there. So obviously, you have your PPEs, you have your hands washed, and this is to limit, obviously, contamination. And if you have your PPEs, then the patient who's there, you may be contaminated with the individual's saliva or their blood. So if you have your PPEs on and they're intact, you won't have to worry about them. So how do you wear personal protective clothing? You must follow some requirements that are there. So you have to have disposable gloves on. The aprons are there when you are administering medication to individuals. This is, again, to avoid contact with the patient, with you, so that you're reducing chances of infection to you. Cleaning equipment. So you must ensure that the equipment that you're using is clean before and after you use it. So you can do it by checking if it is clean before use, by only using the correct method for cleaning equipment, as it comes with its manufacturer's instructions. And then disposing of equipment and material is very important. Disposing of sharps is very important. Your PPEs, they must be disposed of properly. So the sharps go in the sharps box that is there for your requirement. And sometimes medication, sometimes some things have to be disposed of in black waste bags. And there are different disposal areas that are allocated for different medications and for different procedures. And then you have to understand agreed ways of working for administration of medications. So you must ensure you have read and understood and follow your employer's agreed ways of working. This is for the standard infection control procedures in order to take when administering medication to individuals. So if there's something you do not understand, you must act by asking your employer or manager to clarify this point before you use those medications. So these are some of the references that you could follow. And next week, Saturday, we'll have our discussion over the assignment. Any questions regarding this whole presentation? So you have 2 assignments. I'm aware of the previous assignment, and I know about this one also. So it's not an assignment, obviously. You just go back and study a bit about it. Instead of me telling it, you'll do a bit about search of it yourself, and then we'll have a discussion next weekend. Is that okay?
Yeah, I think if you can just make available your presentation today.
Yeah.
And I think last week's presentation. So if you can share it with us in the WhatsApp group, that's today, Saturday, and last week's presentation is not inclusive. If you can help us share it in the WhatsApp group so we can follow up. Yes. Then the other mail you asked me to send, I'll be sending it later today because I got so busy. So the module has not been open. If you can have a template of a care plan or how to prepare a care plan, I think it would be nice. Thank you.
That's fine. Yeah, that's okay. Any other questions?
The question I want to ask, you're talking about the assignment.
Yeah.
Is it on the how to prepare the care plan? or the general assignments that we need to submit based on the topics.
Okay.
Which one are you referring to?
I didn't get your question. Can you repeat your question again? Sorry.
Yeah, what I'm saying is that you mentioned assignments, maybe about the care plan. Is
Okay.
it care plan
yeah.
alone, or generally on the whole topics you have taught us?
The assignment that I mentioned yesterday, is that what you're talking about?
Yes.
No, it's just so whatever we are covering, that could be a part of your assignment. We've discussed the assignment earlier in the first week. So you can have a look at that presentation also, but we'll have another assignment discussion later on next week, weekend. So what I meant was that sometimes there's some topics that I would want you to do on your own.
Okay.
So the instance that I've just shared with you now, that I would request you to just go and read this up, and if you can add some more and then add it in your assignment also. Please be aware that whatever we are teaching you, they could be a part of your assignment. And if you could see the assignment brief that's on Moodle, it's all been covered through these presentations. So if some assignment, so let's say I want you to do this on your own, pick up on your own. So it's just to generate a discussion. So it's not just a one-sided thing. So you're talking to me instead, and I'm not just the only one who's talking. Does that make it clear?
Okay, so what you are saying is that we should do extra research in addition with what you have taught us.
Yeah, you could do extra research. Yeah, you the books that I've provided to you, like books, you could read through them, and you could do this extra research.
What do you say? Hello? Hello? Hello?
That if you have your extra research there, always help.
The audio is not clear again.
Is that okay? Okay. Thank you so much for your time, and sorry for this thing that happened today. It was just like a misunderstanding. Yeah, so that's done. Today's lecture is done. If you have any questions, always feel free to I'm happy to answer those questions, and we'll meet then next week. Is that okay?
Yes.
Thank
If
you
I
so
need
much.
if I need anything, I will send it to you on email. I will email you.
That's fine.
Yeah.
That's fine. Thank you.
Yeah.
Take care.
Bye.
Stay
Yeah.
safe. Bye. Bye, everyone.